800 children alone every day are dying of HIV and HIV-related illnesses. If women and children are affected in this way, our populations, our communities, our families, our societies, whole countries are severely debilitated. Our advocacy and campaigning work around HIV at the moment is raising awareness not only with our governments and with the United Nations AIDS program, working with WHO, but putting pressure now as far as we can through our work on pharmaceutical companies to provide medicines, to provide drugs that are adequate and appropriate to children who have HIV and who have tuberculosis.
People not only they didn't have medication or access to testing, but they also didn't have access to food.
We need to convince the caregivers how to give them drugs, how to help them remember to take their drugs at the right time, to ensure that the family that they're staying with, if their parents have died, has enough food, to really make sure that the child is being cared for both psychologically as well as physically.
We are talking about saving mothers, saving babies. Nothing could be more noble than stopping babies being born with HIV.
While the United States is the largest donor of global aid, the church in turn is the world's largest aid delivery organization. So clearly, my friends, our partnership really matters.
Universal access is about social justice, practical act of compassion and service. A passion for justice for the poor is something close to your heart. When the world cares enough, resources can always be found. In the AIDS movement, we look to the church for leadership. If we come together and if we make sure that we develop a new movement for making sure that no child will be born with HIV, we can start seeing a new generation free of HIV.
Programs are really people translating those dollars into a compassionate and passionate way of delivering services to the least among us. The new goals under what was originally PEPFAR 2 now will be part of the Global Health Initiative under President Obama and Secretary Hillary Clinton is to treat at least 3 million people, prevent 12 million new infections, and care for 12 million people, including 5 million orphans and vulnerable children. President Obama has endorsed PEPFAR and endorsed a greater vision for global health under the Global Health Initiative that other large multilateral granting organizations, including the Global Fund, need to undergo the same analysis to carefully look and make sure that we're utilizing all partnerships, both in the Global Fund and other bilateral donor implementation.
When Anna Maria arrived to participate in DREAM, she weighed a skeletal 64 pounds. And when she discovered that she had AIDS, her husband abandoned her and her neighbors isolated her. She was convinced that she was about to die not just because of AIDS, but because of the stigma that she felt. But today, Anna Maria is alive and well, and her children are well.
So we are focusing on antigen, antibody, molecular detection, physical detection, probe detection, and of course immune cellular systems. Find the right level, and we have to further simplify our methods to be able to provide appropriate diagnostics at each level of the diagnostic system or network. We have to find the best way of integration at each level of the diagnostic network. That the core and the fundament of such a service and network should be the integration of specimen collection and transportation. That we can try to provide these services under the same roof, if possible, at certain levels of the diagnostic network.
now everyone has access to drink because all the treatment, assistance, procedures and diagnostics are completely free of charge.
Je suis africain, je vais parler avec les cœurs. Le pays est assez grand. La conférence épiscopale, les évêques, ils ont dit, nous allons essayer de faire de la lutte contre le VIH/SIDA notre chemin de bataille. Et c'est comme ça que vous pouvez voir, en fait, c'est que l'Église, excusez-moi, c'est que le nombre de structures que le pays offre, mais le nombre aussi de services que couvre la Caritas. Le grand défi qui se présente chez nous, c'est que une organisation comme Caritas, et nous avions, l'Église a dû préparer un plan d'action, n'est-ce pas, de lutte contre le VIH/SIDA, un processus, je dois vous l'avouer, très participatif. Toutes les organisations, que ce soit au niveau de l'État, que ce soit au niveau du système des Nations Unies, ont participé à l'élaboration de ce plan et on n'arrive pas à faire démarrer ce plan pour l'instant.